welcome to another edition of Data with Dylan. I am Dylan Steigerwald, the epidemiologist for the Jefferson County Health Department. And again, this week we're going to be going through the Jefferson County Weekly COVID-19 Surveillance Report. We will be going through the Week 26 report, which goes from June 21st through June 27th. During Week 26, we had a total of 63 confirmed and probable COVID-19 cases reported. And that brings us to a year-to-date total of 522 confirmed and probable COVID-19 cases in Jefferson County. We stayed at 21 COVID-19 associated deaths, and we are still at 6 reported outbreaks of COVID-19 reported in our long-term care facilities. Just a reminder that it only takes one case in a long-term care facility, our nursing home, to be considered an outbreak, and that's when we go in and we test everybody there to get them the resources that they need. Looking at Table 1, the number of confirmed and probable COVID-19 cases by week, we see in Week 26 that we had 63 cases, and that brought us up to a total of 522 confirmed and probable cases. Looking at Figure 1, the number of confirmed and probable COVID-19 cases by week, we can see visually that we've almost doubled our case count the last 2 weeks in a row. So we are on the increase of cases. Looking at Figure 2, our cumulative confirmed and probable COVID-19 cases by week, we can see that we are steadily increasing our cumulative total of cases. Figure 3, something I added this week, looking at the COVID-19 daily case count and then the 3-day rolling average. So that kind of gives us some smoother peaks and valleys because some of the days we may have spikes and others may be lower, but this kind of accounts for the 3-day average. But we can see here, even with taking that into account, we have an increase in the last few weeks here. Figure 4, confirmed and probable COVID-19 cases and age-adjusted case rates. We're still seeing our highest case rate in our 80-plus age group, and that's largely due to the number of cases in our long-term care facilities. But we see that the rates in our other middle age groups are steadily increasing. So our 50 to 59, 60 to 69, those keep inching up every week with our rate per 10,000. Figure 5, COVID-19 hospitalizations and hospitalization rates. We added hospitalizations this week to both our 50 to 59 year age group and our 70 to 79 year age group, which raised those rates. So we can see our highest rate of hospitalization is in our 70 to 79-year-old age group, again, largely due to the number of cases in our long-term care facilities. But again, those middle age groups, 50 to 59 and 60 to 69, are steadily increasing each week here. Figure 6, another new addition to the weekly report, are our positive hospital admissions and 7-day average in Jefferson County. So this is looking at hospitalizations of people who tested positive for COVID-19. And the date that we're using for this is the date that it was reported to the health department. And we can see our 7-day average there too. So we started increasing in March and April, and then steadily decreased until around May and through the beginning of June there, but now our hospitalization rate is starting to increase again in late June. And that makes sense with the increase in cases that we have. Figure 7, looking at the COVID-19 fatalities and fatality rate by age group. This has stayed the same since last week because we didn't add any COVID-19 fatalities. And what I will say is that we usually see our fatalities lag behind our case count. So our case count usually will increase first, and then we see an increase in fatalities after that. And that's the same thing we see with other things like influenza. Table 2, the approximate COVID-19 cumulative fatality rates. We decreased again this week. We're down to about 4% fatality rate for our county And as I've said, as we get more testing and more people positive, we'll probably see our middle age groups start to become the majority of our cases, which have a lower fatality rate, which will lower our cumulative fatality rate. Figure 8, COVID-19 cases by sex in Jefferson County. We still see that females make up the majority of the cases at 59%. Figure 9, COVID-19 PCR test results by week. And we can see in week 26, we had another increase. We've increased for the last few weeks here. We're up around 6% of our tests have come back positive, which is another indicator that we have more community spread and more people are testing positive for COVID-19. Table 3 shows you the week-by-week breakdown of the testing results for PCR testing. And we can see from week 25 to week 26, we more than doubled our percent positive rate, going from 2.1% positives to 6% positives. Table 4, COVID-19 cases and rate per 10,000 by race. We still see the majority of our cases are in our white population, but still when we look at that rate per 10,000, that Black population in Jefferson County has the highest rate. Although in the last couple weeks here, we have seen an increase in the rate in our white population. Figure 11 is looking at our COVID-19 cases by zip code. And this is just our raw look at how many cases are in each zip code. We still have by far the highest number of cases in our Festus area, that's 63028. And that's because we had a couple of long-term care facility outbreaks in that zip code. Our second highest number of cases is in our Arnold area, which we might expect being closest to the St. Louis region and one of our more populous areas. When we break down the COVID-19 cases by zip code per 10,000 residents in figure 12, we see that rate there. And still in our Festus area, we have the highest rate. But in some of our other zip codes, where we have not seen long-term care facility outbreaks, we see our rates steadily rising little by little in the last few weeks. Again, in the 63070 zip code, we've had increases for the last 3 weeks. Figure 13 is the map. Looking at the map, we can see where the darker shades of blue are indicate a higher case count in those areas. And again, we can see our darkest shaded areas are towards our St. Louis region, where we have more populous zip codes, and also down in our Festus area, where we've had a couple long-term care facility outbreaks. So looking at these numbers and data, excluding the cases in our long-term care facilities, in week 26, we saw a total of 36 confirmed and probable COVID-19 cases, excluding long-term care facilities. So even excluding those cases in our nursing homes, we're seeing an increase in the last few weeks of cases. And the majority of our cases overall have been in our general population, with about 65% of our cases not from long-term care facilities. When we look at our confirmed and probable COVID-19 cases and age-adjusted rates excluding long-term care facilities, we see a steady increase by age group from our 20 to 29 through our 50 to 59 age group, which has the highest rate of 18 cases per 10,000 residents. When we look at the approximate COVID-19 cumulative fatality rate, excluding our cases in long-term care facilities, we see that rate drops off significantly to around 1.79% compared to 6% when we include the long-term care facility cases. Looking at the COVID-19 cases by sex, excluding the nursing home cases, we see that that ratio becomes more even between the sexes. And Jefferson County has basically a 50-50 split in our population between males and females. So we are seeing slightly more cases in our female population. And again, a reason for that might be because women live longer and we have more women in our long-term care facilities. So when we exclude those, we see a more even split. Looking at the COVID-19 PCR test results by week, we can see even excluding those nursing home cases, the percent positive in our test run has increased the last few weeks. So we've gone from 1% positive in our PCR tests in week 24 to more than double that at 2.1% positive in week 25. And again, another increase in week 26 to 3.2% positive. And that's another indicator that we are having an increase in community spread. More people are becoming positive. When we look at our COVID-19 cases and case rate per 10,000 by race, we still see the majority of our cases are in our white population, but still have a slightly higher rate in our black population. Those rates do kind of even out when we exclude our cases in nursing homes. As we can see, our white population has a rate of 14.4 cases per 10,000. Our black population has a rate of 14.9 cases per 10,000. Our Asian population has a rate of 11.1 cases per 10,000. Now looking at our COVID-19 cases by zip code, again excluding our long-term care facility cases, we can see by far our highest zip code now is not our Festus area, but our Arnold area, with about 58 cases reported there. And then looking at our rates of COVID-19 cases by zip code per 10,000 residents, we see that those rates across our zip codes are much more evenly spread out. And actually our highest rate in a zip code is now our 63070 zip code with 18.8 cases per 10,000 residents. And as I've said, that zip code has seen a steady increase the last few weeks. We know for a fact that these are probably underestimates of our actual caseload in the county for different reasons, including at first, there wasn't the testing availability to get everybody tested. And also some people don't seek testing even though they're sick. So we know that the number of cases that are reported to us is most likely an underestimate, that tip of the iceberg, but that there are most likely more cases out there in the county. And that's one reason we want to continue our social distancing, the 3 W's of wash your hands, very important, for 20 seconds, wear your mask when you can, and wait 6 feet apart when possible. Avoid that close contact with others. And those are really the ways that we're going to slow the spread of COVID-19 in our community. So this has been another edition of Data with Dylan. Stay safe, Jefferson County.